Regenstrief has looked at over 47,329 cases this week. Of those, about 25% visited the emergency department, which is steady from last week. A total of 7,333 were hospitalized, which represents 16% of all the positive cases. This is also basically unchanged from a week ago. Of those who were hospitalized, 21% were admitted to the ICU, which is consistent with what we've been seeing in past weeks. This represents 3% of all positive patients. 74% of hospitalized patients have been discharged, which is steady since last week. Of the remaining 26%, 7% are believed to still be hospitalized, and nearly 19% are known to have died while hospitalized. Regenstrief also estimates that 78% of patients have recovered, which is the same since June 30th. We continue to monitor the data surrounding our 4 guiding principles for our phased reopening: hospitalization, surge capacity, testing ability, and contact tracing. What concerns me is that we're seeing more overall COVID-19 infections. Our current positivity rate is increasing, meaning that of the Hoosiers tested for COVID-19, more have had positive results. The 7-day average positivity rate in Indiana was 5.9% through July 4th, but the single-day positivity rate on July 4th was 6.4%. The rate has steadily increased. By comparison, our lowest positivity rate was on June the 18th, when the 7-day average was 4.1%. With more cases, we're also beginning to see an uptick in hospitalizations over the last few days. On July 7th, 667 COVID-19 patients or persons undergoing testing for COVID-19 were admitted to hospitals across the state, up from the low of 595 patients on June 26th. As we've talked about before, the positivity rate is one of the key principles driving our decisions for the Back on Track Indiana plan. The rates of positive tests have been rising in specific areas throughout the country, and we're also seeing a few localized hotspots in a handful of Indiana counties. We anticipated this, which is why we paused the reopening plan last week, and that decision has been confirmed by the numbers that we've been experiencing. When we moved to stage 4.5 last week, we kept many guidelines at stage 4, but we also opened some larger activities such as festivals and camps as long as social distancing, masks, and other prevention plans were in place. But in consultation with the Indiana State Department of Health, and following the slight uptick of COVID-19 cases, and after having discussions with us, the Indiana State Fairgrounds and Northern American Midway Entertainment has decided to cancel the Fairgrounds Fun Park that has been planned for July 31st through September the 7th. The carnival provider and State Fairgrounds had a thorough and very thoughtful plan on how to conduct the event safely, but have concluded that it's best not to move forward with the fun park. Smaller 4-H livestock shows will be conducted at the State Fairgrounds. I'd like to remind Hoosiers, whether you're planning on attending an event or just planning to attend an event where there will be lots of other people, please stick to the safety plan that you created. Wear a mask, keep socially distanced, wash your hands frequently or use hand sanitizer. Stay home if you feel sick, and of course, get tested. Those strategies are there to help protect yourself and each other from infection while enjoying some very long-awaited fun and entertainment. Thank you.
Well said. It can't be said enough, I guess, though. As good as the plan is, and we've seen a lot of good plans, they got to be followed.
Exactly. And I can't tell you the number of times we've seen through contact tracing that people have said, we had a great plan, we just didn't follow it.
Yep. Thank you. Luke Basso from the Indiana Economic Development Corporation, you've got some updates on PPE status, inventory, even some shipments going out to schools.
Yeah. Thank you, Governor. Luke Basso, Chief of Staff, Indiana Economic Development Corporation. Since the beginning of the pandemic, the IEDC has been focused on securing personal protective equipment for the state to be used by healthcare providers and then to also help businesses be able to safely reopen. We have not taken our foot off the gas since day one, and each week we are securing more manufacturers and buying more equipment so that we can help guarantee our state and its workforce and healthcare providers can protect themselves as we continue to navigate the pandemic. And to date, we have received more than 26 million pieces of PPE. Our next task is helping Indiana schools be able to safely reopen. At the direction of Governor Holcomb, last month the IEDC procured over 3 million reusable masks that will be used for Indiana's K-12 public and private school student population. Students at each of the participating schools will receive masks for them to utilize during the school year. IEDC, through a survey with the Indiana Department of Education, was able to identify the need for each school throughout the state. The program was made available to all public charter, and private schools in Indiana. As of today, we have 472 school corporations, charter schools, and private schools participating. In addition to the reusable mask for students, the participating corporations or schools will also receive 500 disposable masks, 2 or 4 ounce bottles of hand sanitizer, and 10-gallon bottles of hand sanitizer. Over the past 2 weeks, the IEDC has been working with Langham Logistics to coordinate contacts and a delivery timeline for all participating corporations or schools. Langham Logistics will begin coordinating with contacts today, and deliveries will start to take place on Monday. Participants will be receiving their bundles based on when the school is reopening for the school year. I please ask schools to be responsive to emails and phone calls you receive from Langham Logistics so you can promptly receive your supplies. Governor, in addition, the Indiana Small Business Marketplace launched on May 6th, and after 2 months, the marketplace has fulfilled more than 30,000 orders and delivered to more than 600 cities. In recent weeks, we've seen a decrease in bundles ordered, and companies have been asking for more access to additional supplies. Today, the IEDC will launch the Indiana PPE Directory, transitioning from the Indiana Small Business Marketplace. The PPE Directory will provide a long-term, reliable, and credible solution for businesses and nonprofits looking to procure PPE. The directory, which is available online at backontrack.in.gov, features Hoosier companies manufacturing or distributing PPE, items such as face masks, face shields, goggles, hand sanitizer, among other items. Users of the website will be able to work directly with the companies to view available products and immediately place purchase orders for the PPE. Currently, the directory features 12 Indiana companies with more applications under review. All companies on the directory have been vetted by the IEDC and are required to be headquartered or incorporated in Indiana. Hoosier businesses interested in being featured on the Indiana PPE Directory are encouraged to review additional eligibility requirements listed online and to contact PPE Directory at iedc.in.gov. Thank you.
Thank you. And we will go directly to the Q&A portion.
Steve with KPC Media.
Good afternoon, Steve.
Good afternoon. How are you doing?
Doing great. How about yourself?
Good, good. 2 quick questions, probably both for Dr. Box. First, on positivity, I've been noticing that uptick as well. We hear from a lot of people that, well, Indiana's just testing more. So can you just explain how a positivity rate is kind of a control for that up and down that we see at testing? And then second question, as cases were rising for a while, we were hearing a lot of people talking about, well, you know, this is just getting us to herd immunity. But everything that I've seen about herd immunity talks, you know, that we would need to see 70 to 80% plus people immune to the disease. So my question is it really feasible for Indiana to get to a point where we may have some herd immunity to COVID-19 without a vaccine?
Thank you. They're both excellent questions. With regards to the first question, we know that numbers of cases, just absolute numbers of cases, will go up as we test more individuals. And we want to continue. We have the ability to test more individuals. We want more individuals to go and get tested. If they're suspicious, concerned, if they're symptomatic at all, if they think they've been exposed to someone who's symptomatic, please go and get tested. But the important number for us is, of those numbers that are tested, how many come back negative and what % of those numbers are positive? You want to be testing so many people that your positivity rate is really down below about 5%. That's where we would like to be. That's what we would like to see. And Indiana actually was down about 4.1% kind of mid to later June. And now we've seen that creep up, and as we've seen it in some pockets across the state. And that can be a sign that we are seeing more actual outbreaks, more actual cases. not just related to the number of people that we're testing. So that positivity rate is something that we really hang our hat on and look at, and it's something that you can look at every day on our website at the www.coronavirus.in.gov. You can actually pick the particular region that the county is in that you're interested in, and then click on that county, and it will give you the specific county data there. Now, with regards to herd immunity, we have some kind of new studies that have come out indicating that this coronavirus, like other coronaviruses, those viruses that cause the common cold, tend to behave the same way. And that is that, we have some viruses where you get it once in your life and you have immunity forever. You're never going to get that virus again. You have other viruses, something like HIV, that you may get and probably will have forever and be able to keep that under control with medications. The coronavirus people get, they develop some brief immunity, the ability to fight that virus off, but unfortunately that immunity doesn't stay around, and that's why we keep getting the common cold over and over again. And that's what these recent studies have indicated, is that even individuals that do develop immunity, develop antibodies, unfortunately those antibodies in many cases are disappearing very quickly. So the concern there is that it doesn't matter how many people we expose, we are not going to probably develop herd immunity, and unfortunately we may just end up with a lot more individuals that have severe consequences or die from this.
And I would just add, again, I'm not a physician. I take my orders from a physician. But, Steve, when you talk about herd immunity or banking on a vaccine, that doesn't account for between now and then. And then is way off in the distance. And as the Fairbanks study showed us, if we're at 3% that have had or have it currently, we're talking about 97% who haven't yet. That's right. And it's still an uber infectious virus rolling around the hills out there. And so we have to focus on controlling what we can. And that's our own behavior. That's how we slow the spread, so that all of a sudden you're not looking at a positivity rate of 14 or 50, or what we're seeing in some other places around the country. So it's just critically important that we don't hope for a vaccine. I'm hoping for it, but just that's not the strategy. And that's our hope for sure. But or herd immunity is so far off. Talk about 70, 80, 90%. That's
even those those countries that have tried it, like Sweden and the UK to some extent, have really not been successful. When they have looked back, they've seen maybe 7% of their population in prevalent studies that are immune, or have any antibodies. I wouldn't even call it immune. And that's why we've been so careful when people have asked us about antibody testing. Is it just because you have antibodies, we don't know that keeps you from getting infected again?
Yeah, and sometimes you're like you just said, it comes back in 4 months, or sometimes you remain positive for 45 straight days. So, the overlap here is the focus has got to be control. We got to manage our way through this, and we got to make sure our healthcare system is not overwhelmed, so we can care for those folks who are positive, who go into the emergency room and then are hospitalized and into the ICU beds.
That's right.
That whole process.
Kayla Sullivan, Fox 59.
Hi, Governor. How are you today? Sorry about that. I'm a little late on those some days.
Very good. How are you?
I am doing all right.
Good. I
wanted to know if you would be willing to comment on the investigation in Bloomington. We've really been having a lot of lawmakers asking you to make public your opinion on this investigation, as well as we were wondering if you could maybe give us more details on the role of DNR in this investigation.
Well, I can comment on it. I'll be brief about it, just because it is, as you just allude to, an ongoing investigation. The brief video clip that I viewed with my own 2 eyes was beyond disturbing, and that's why it's very important that the DNR and they will complete their investigation sooner rather than later. They're working on that. I think it's right around the corner. And then they will, in turn, turn it over to the Monroe County prosecutor, and they will take it from there. And this is, from everything that I've reviewed, the DNR has always and continues to act absolutely appropriately per protocol. And so that investigation will be turned over to the county prosecutor, and they will take it from there.
Justin with the Westville Indicator.
Good afternoon, Justin.
Good afternoon, Governor. Dr. Box, you had stated last week that the testing numbers on the state's website show the number of individuals tested rather than the total number of tests conducted. Will the state be releasing additional data to give us a clearer picture about the number of individuals who have been tested multiple times?
The last time I talked to them about that, we had over 100,000 additional tests that would be on there if we included that. But I don't know that we have it broken down as Mary Smith had 3 tests or John, Ford had X number of tests. So I can certainly ask my data team, but they did correct me on that, so I wanted to make sure I corrected it.
Whitney Downard, CNHI.
Good afternoon, Whitney.
Good afternoon. I can't tell you how excited I am about that nursing home database. Just to start off, I wanted to ask about the infection control survey specifically. We completed those a month ahead of schedule, even though we kind of have a high per capita rate of facilities compared to some other states of similar population sizes. So I wanted to know how exactly those infection control surveys were prioritized and how the state was able to complete those on such a fast pace. And then I have a second question.
So to my knowledge, we had already been working on those infection control surveys and didn't realize there was a drop dead date that those needed to be completed. So we basically just were able to wrap up the rest of the surveys. I mean, we have a great survey team. They have been incredibly actively engaged, and we have put more manpower toward that because we've needed it from infection control around the state for further education and helping to do infection prevention and cohorting individuals that are positive for COVID. And the other question that you had?
I just had a little curiosity about that interactive dashboard. Is it going to be able to sort by a point in time versus cumulative? And then will the results from the staff testing be part of that dashboard, or will that be a separate release?
The results from the staff testing will be a separate release. We currently have Fairbanks School of Public Health and IU's aging division that are looking at that data to try to help us to analyze the data so that we can use that to actually direct, do we have to test, every single employee every week, every month, or can we identify maybe hotspots in the state and do testing? So is there a correlation with certain hotspots and do testing directed based on that? So they're looking at all of that data, and we hope to have some further information by the end of the month on that. When we look at the long-term care data, the plan is to have a dashboard so that you will be able to search by the particular facility that you want. You should be able to look at the number of infections and when those infections occurred in the facility. You should be able to look at the number of employees that were infected and the number of deaths of both residents and employees. And there may be more on that I'm not familiar with, but I do know that they're trying to make that very user-friendly.
Sarah with WNIN.
Good afternoon, Sarah.
Good afternoon. This question is for the governor and Dr. Box.
Okay.
Vanderburgh County has seen a surge in cases, we're told, among young people who have been traveling to places like Florida. We have one instance of a graduating senior who went to Florida, met some people from Texas there, came home to Indiana, attended graduation parties, and a few days later tested positive for COVID. With school officials working furiously to make plans for the school year, how would you encourage young people and their parents to act responsibly leading up to the start of school?
You said Vanderburgh County?
That's right.
Okay.
Yes, you want to go ahead?
No, go ahead.
We have seen an uptick of cases in Vanderburgh County, a little bit in Warwick County, and have been in contact with officials there. The Deaconess Hospital is doing testing there, and they have additional testing open for the public. I would say that they have an excellent health officer and health department there who are all over this and taking really good care to make sure that they help us in the contact tracing in this situation. The personal responsibility for our young adults is something that I first of all, realize we are not going to reach them at this 2:30 presser, Monday through Friday. So we are really looking to figure out where in social media and what areas we can reach out to them and how it's going to resonate with them. Because young adults and even teenagers are very passionate about the things that they care about, and they will stand up for what is right. And so we have to be able to give them the message in a way that they understand that it's critical, that they are the difference in whether those infections are brought home to maybe their mom that works at a long-term care facility or their grandma that has underlying health conditions. So we are looking into that and working very hard on making sure that we do reach individuals.
Yeah,
in that age group.
we were, Sarah, going back and forth about this. You know, it can't just be us in this limestone building or health officers in 92 different counties. We got to get out to the broad citizenry and connect with each Hoosier, and that may mean, you know, college student athletes saying, if you want to watch me play football or basketball, mask up, or it may be